The guest is Dr. MKanu3, and of course the topic is President Obama's health plan. And of course, Dr. MKanu, let me sort of bring us back into this third segment by having you to deal with what we consider to be one of the major health problems, and that is problems with many of our young children, so-called childhood obesity. And I think that you've already mentioned the importance of prevention, and so let's see if we might be able to tie those two together during the last part of this particular show.
Sure, absolutely. Obesity is a very big problem, not just for the state of Tennessee, for example, but this is a national crisis, you know, and it's very important, you know, to understand that how big a problem that is, to try to understand what are the determinants, you know, what are the things that cause this kind of a problem. Well, we know them, you know, and that's the important thing. You know, we think we know this information. The information is out there, but sometimes you hear people talk about how do we actually translate research to practice.
Okay.
You know, that's always a problem. But let's step back and look at the obesity issue that you just talked about. What are the factors if you are to address this particular problem in a significant way? What do we do? Well, obviously, we know that diet is a very serious problem. What do we give our youngsters to eat? You know, that's very important. And then we talk about physical activity, which is the other component to this. You know, how much physical activity is good? You know, we need to talk about all of how far we've come along. You know, there have been times when people think, you know, exercise has to be very vigorous before it can produce health benefits, you know, which was a factor that for a very long time made it very difficult for people to exercise. That was number one. And number two, they also argued, or there was this misconception, I should say, that leisure time physical activity has to be done in one block of time.
Okay.
You know, if you don't do it that way, again, you don't have the benefits that are associated with that. All of that is very fallacious, we know now.
Okay.
So in other words, what we are saying is that you can exercise in 5, 10 different bouts of times, you know, and cumulatively that is going to give you health benefits. You know, so again, the important thing when we talk about the problem of obesity is that we have to make sure that our kids exercise. We have to make sure that our kids eat well. Now, of course, there is a third component to this, you know, which is the genetic factor.
Okay.
What are you born with? You know, there are some kids, you know, some of us come from families where parents are who they are, a little bit heavy set, but, you know, some of the other too, you know, maybe we cannot do much about the genetic factor because that's a non-modifiable factor. But exercise as well as what we eat, those are things that we can actually control. And so again, that takes us back to the issue of prevention, as I said earlier on. How do we prevent some of these issues? We see the correlation now between lack of exercise, for example, with the number of diabetic youngsters these days. Something which used to be for more seniors, you know, seniors or people who are elderly, you know. Childhood obesity,
diabetes,
diabetes now, exactly.
Yeah, good.
You know, and these are very serious problems now. So we have to look at environmental factors. We have to pay attention to those factors that are modifiable. These are ones that we can change. So again, it goes back to what I said earlier on about looking at the public health model, which is more about prevention, as opposed to the clinical model. Now, these are two aspects of the same thing. I'm not suggesting here that they are exclusive, you know, or mutually exclusive. They are supposed to complement each other. So in other words, if we emphasize prevention, you know, there are some things that will not catch. You know, so those that will slip through the crack, hopefully, will be able to catch and be able to treat in a clinical setting. And I think one of the problems that we've had as a nation is the belief that we can treat everything from a clinical point of view. You know, I can do what I need to do. I'll eat what I need to eat or what I want to eat. If I get sick, I'll go to my doctor and I'll go to the hospital and we can take care of that. Well, of course, you know, there are some diseases that we can manage. You know, but once we have them, we really can't eradicate them again. What is the important message? The important message is that if you have a disease that is not going to kill you immediately, but it's going to be there for a very long time, yes, you can manage it. But guess what? You are going to compromise the quality of life that you will live. So again, these are very important issues. So if you go back to the plan that we are talking about, all of these components are there. What I gave you earlier on, the 8-point plan is just a summation of the plan. But when you look at the plan, there are several contributing factors that are very important. There is something about HIV, you know, with all of the stigma associated with this.
But that plan does have an HIV component.